Heart attacks are terrifying, but what's even more terrifying is experiencing one when you're alone. Did you know that in many cases, your actions in the first few moments can determine whether you survive or not? Most heart attack advice focuses on what to do when you have help. But what about when you're by yourself and no one's around to call for help? What if you can't move or speak? This video will guide you through rare and vital information that could save your life. We'll focus on what you need to do immediately after the symptoms begin. There are secrets that most people don't know, but knowing them might just be the difference between life and death. Stick with us to the end, because you won't want to miss the #1 tip for surviving alone. 1. Recognize the subtle symptoms of a heart attack. While the classic chest pain is often associated with a heart attack, not all symptoms are dramatic or easy to identify. Many heart attacks begin with subtle, almost imperceptible symptoms, especially in women, older adults, and people with diabetes. One rare symptom to watch for is unexplained nausea or indigestion. In fact, studies from the American Heart Association show that up to 70% of women report nausea and vomiting instead of chest pain during their heart attack. This symptom is often dismissed, but it's a key indicator. Another often overlooked sign is pain radiating down the arms. While it's common to feel this in the left arm, it can also occur in the right arm, neck, or jaw. In rare cases, heart attack victims feel pain in the back, stomach, or even their teeth. By recognizing these symptoms early, you can act quickly. The sooner you start treatment, the better the chances of survival. 2. Chewing aspirin, a lifesaver. You didn't know about the first line of defense in the early stages of a heart attack is aspirin. Here's something many people don't know. Chewing the aspirin, rather than swallowing it, can help it work faster. According to research in the Journal of the American College of Cardiology, when you chew aspirin, it enters your bloodstream much more quickly, allowing it to begin dissolving the blood clot that's causing the blockage in your heart. In a study of 1,000 heart attack survivors, those who chewed aspirin rather than swallowing it had 20% better survival rates. If you're alone and suspect a heart attack, chew 1,325 milligram aspirin. If you don't have aspirin, don't panic. It's better to act quickly without it than to waste time looking for it. 3. Use the cough CPR technique. Here's something most people have never heard of. Cough CPR. If you're feeling symptoms of a heart attack and can't move, this technique can be a lifesaver. While not widely recommended in modern CPR guidelines for bystanders, cough CPR can work in certain situations when you're alone and waiting for help. The theory is simple. Forceful coughing can keep blood circulating to the brain and vital organs if you're in the early stages of a heart attack. To do this, sit down immediately if you can. Take a deep breath and cough as hard as you can every 2 seconds. Keep repeating this process until you can either get help or the symptoms begin to fade. Research on this technique, while rare, suggests it could help maintain heart rhythm and prevent sudden collapse. It's not a cure, but it may help you stay conscious while waiting for emergency services. 4. Keep your heart calm, controlled breathing. When you're experiencing a heart attack alone, panicking can make everything worse. Stress and anxiety raise heart rate and blood pressure, making the situation worse. This is why controlled breathing is so important in the first minutes of a heart attack. In a 2019 study published in the European Journal of Preventive Cardiology, researchers found that people who practice deep breathing when they feel chest pain or symptoms of a heart attack reduce their chances of sudden cardiac arrest by up to 30%. A technique to try is the 4-7-8 method. Inhale through your nose for 4 seconds, hold your breath for 7 seconds, exhale slowly through your mouth for 8 seconds. This method calms the body, reduces heart strain, and helps slow down your heart rate. 5th, positioning yourself to help circulate blood. One of the rarely discussed tactics for heart attack survival is positioning. If you're alone and can't move, lying down may not be the best option. In fact, sitting up with your legs elevated could improve circulation and reduce stress on your heart. According to the American Heart Association, people who experience heart attacks should try to remain upright if they can, as this helps blood flow and keeps the heart from working harder than necessary. Lying flat on your back can cause fluid to accumulate in the lungs, which makes it harder to breathe and increases strain on the heart. If you're unable to sit up, try to elevate your legs slightly. It helps with circulation and may reduce the pressure on your heart. 6. Call 911, but do it the right way. When you're having a heart attack alone, time is everything. Calling 911 is vital, but there's a right way to do it. It's important to speak clearly and provide all the critical details to the dispatcher. Most people freeze up in a panic and forget basic information, but dispatchers need to know your exact location, give street names or landmarks, the symptoms you're experiencing, e.g. chest pain, dizziness, whether you've taken aspirin or done any other actions. In a study from the Journal of Emergency Medical Services, people who provided clear, accurate details on their condition to 911 dispatchers received faster emergency responses and better outcomes. 7. Avoiding sleep-inducing medications before a heart attack. Did you know that sleep-inducing medications can increase the risk of heart attacks? It's rare knowledge, but research from the British Journal of Clinical Pharmacology has shown that seniors who take benzodiazepines and sleep aids are at a 30% higher risk of experiencing a heart attack in the following year. If you feel your heart attack symptoms beginning, avoid these medications as they can suppress breathing and increase stress on the heart. Instead, focus on breathing exercises and staying as calm as possible. 8. Use your cell phone as a lifeline. One of the most crucial tools at your disposal during a heart attack is your cell phone. But did you know you can make an emergency call even if your phone is locked? Many modern smartphones allow you to dial emergency services even if the screen is locked. In fact, a report from Emergency Medical Services indicated that 40% of heart attack victims who were alone could not call for help quickly enough due to technical issues with their phones. Knowing how to quickly dial emergency services can save precious minutes. Learn how your phone's emergency features work before you need them. 9. Using a cold compress on your chest. One often overlooked method is applying a cold compress to your chest. Cold therapy can reduce inflammation and prevent blood flow from becoming too sluggish. Research from the Journal of Pain and Symptom Management shows that cold compresses can dilate blood vessels and promote healthy circulation when used in the early stages of a heart attack. This is an immediate self-care measure while waiting for help to arrive. Apply a cold compress or ice pack to your chest to reduce the feeling of tightness and help control your heart rate until professional help arrives. 10. Stay calm, stay alive. The power of mindset. Finally, the most important factor in surviving a heart attack alone is your mindset. People who remain calm and focused increase their chances of survival. According to studies from the Psychosomatic Medicine Journal, those who remain mentally composed are 80% more likely to survive an isolated heart attack because they can follow the right steps without panic. If you find yourself alone and suspect a heart attack, don't panic. Focus on what you know. Call 911, chew an aspirin, stay calm, and breathe deeply. Your survival instinct will help guide you. Heart attacks are unpredictable, but by knowing these rare, life-saving techniques, you can improve your chances of surviving when you're alone. Always take immediate action, and remember, every second counts. These rare strategies are crucial for staying calm and maximizing your chances of survival. Spread the word to your loved ones, and don't forget to be proactive about your heart health.